Hi everyone, welcome back to MedSurg Mentor. Today let's review the topic infective endocarditis. It is a rare but potentially fatal condition caused by bacteria or fungi. Let's begin. Definition of infective endocarditis. It is a disease in which the infective organism invade the endothelial lining of the heart, usually involving one or more valves. Next is predisposing factors responsible for the development of infective endocarditis. There are four main groups of people who are at risk for infective endocarditis. They are people with underlying health problems such as rheumatic heart disease, congenital heart disease, hypertrophic cardiomyopathy, and degenerative valvular disease. People who have undergone surgery such as valve repairs, pacemaker implantations, and prosthetic cardiac valves. Third category is people who are IV drug users. And the fourth category is patients who are immunocompromised, such as organ transplants and people who have HIV. Etiology of infective endocarditis. It can be caused by either bacteria or fungi. Common bacteria causing infective endocarditis are Streptococcus viridans, Streptococcus pneumoniae, and Streptococcus pyogenes, Enterococcus faecalis, Staphylococcus epidermidis, and Staphylococcus aureus. Common fungi causing infective endocarditis are Aspergillus, Candida, Histoplasma, and Blastomyces. Causes of infective endocarditis. Infective endocarditis occurs when bacteria or fungi enter bloodstream and reach in heart. Common modes of entry are open wounds, needle used in tattoos, intravenous drug use, dental procedures, catheters, and infected cuts. Pathophysiology of infective endocarditis. Due to etiologies, there is damage to valvular endothelium. As a result of this damage, platelet fibrin thrombi is formed. At this stage, the microorganisms are attached to the platelet fibrin thrombi. Next, there is proliferation of the infecting organism, which results in lesion formation. At the next stage, bacteria are spreading to the bloodstream, which is called bacteremia. At the same time, due to the lesion formation, the valve leaflets are gradually damaged, resulting in leakage. It results in heart failure at the final stage. Also, the lesion gradually increases in size, resulting in formation of emboli, leading to complications like stroke and organ damage. Common clinical features of infective endocarditis are fever more than 100 degrees Fahrenheit, pain, red warm or draining sore, white patches in the mouth, nausea, vomiting and diarrhea, sore throat, nasal congestion, headache, persistent cough, sweats or chills, and skin rashes. Common skin manifestations of infective endocarditis are splinter hemorrhage, Osler's node, petechiae, and Janeway lesions. Another common manifestation of bacterial endocarditis is Roth spot. These are white-centered retinal hemorrhage. Next is Duke's criteria. Duke's criteria is used to rule out infective endocarditis. Major criteria are positive blood culture and evidence of endocardial involvement. Minor criteria are predisposing conditions like intravenous drug use or cardiac conditions, fever more than 38 degrees Celsius, vascular phenomena such as arterial embolism or stroke, immunological findings like Osler's node or rod spot, and microbiological evidence for presence of organism. Other common diagnostic measures done to identify infective endocarditis are physical examination, blood culture, blood studies like complete blood count, echocardiography, electrocardiography, chest X-ray, CT and MRI scan. Common complications of infective endocarditis are stroke, heart failure, renal failure, heart valve damage, seizure, embolism, splenomegaly, and organ abscess. Now let's move on to the management of infective endocarditis. First one is intravenous antibiotic therapy. Commonly used antibiotics are penicillin, gentamicin, vancomycin, amoxicillin, ampicillin, and ceftriaxone. Commonly used antifungal is amphotericin B. Other surgical managements are heart valve repair, heart valve replacement, and heart valve debridement. Common nursing diagnoses for patients with infective endocarditis are decreased cardiac output related to valvular insufficiency, activity intolerance related to oxygen imbalance secondary to valve dysfunction, hypothermia related to infection of endocardium, impaired gas exchange related to the valvular damage, imbalanced nutrition status related to anorexia, acute pain related to the infectious process, and fear and anxiety related to the disease process. Nursing care of patient with infective endocarditis. Monitor temperature, oxygen saturation, and heart sounds. Assess signs of organ damage and emboli formation. Administer antibiotic therapy. Reduce physical activity. Encourage adequate fluid and nutrition. Provide supplemental oxygen. Review blood urea nitrogen and ECG. Prepare patient for valve surgeries. And provide health teaching. With this, we are finishing the review of infective endocarditis. It is an infectious disease affecting the inner lining of the heart muscle caused by bacteria or fungi that entered through the bloodstream. It gradually affects the functional ability of the heart and other vital organs. Common managements are antibiotic therapy and valvular correction procedures. Thank you so much for watching and see you next week with a different interesting topic. If you like this video, please like, share and subscribe.